Hi, my name is Vera Rhodes, and I currently live in Trenton, New Jersey. Almost 5 years ago now, I started with mild pain that just progressively got worse in my hip. Um, I'm one of those people that didn't have a lot of trust or faith in doctors, so I just kept putting it off till I got to the point that I was in pretty much constant pain 24/7. A friend of my brother's had had her hip replaced at Penn Medicine Princeton Medical Center and had used Dr. Gutowski, and she recommended them both very highly. So when I was ready to have something done, that's who I reached out to.
I remember Vera very, very well. She had a joint that was so worn out that it just would not work anymore, and she needed a joint replacement. Her compounding issue was that she was clearly heavy, and we know that when we do joint replacements on very heavy patients, the risks of the surgery go up.
Patients who are morbidly obese who need joint replacement are referred to us. We do bariatric surgery and help them lose the weight, and then they're able to go on and have their joint replacement at a lower risk and with higher success.
He told me that there was a bariatric group in the hospital that he worked closely with, Dr. Dubruskin, and her nurse coordinator, Donna, and he said that he would, if I was interested, he would have Donna reach out to me. She explained that she had had the surgery herself and just pretty much step by step went through what the whole process was going to be for me.
My favorite part of the job is actually kind of navigating the patient through the journey of weight loss and bariatric surgery. About 5 years ago, I had the sleeve surgery myself, and it gave me a lot of insight. They feel like, okay, you've walked in my shoes, you know what I'm actually going through. Then it's a little more personal, and it's a little bit more insider's view kind of thing.
When I went to see Dr. Dubruskin, who did my bariatric surgery, and I weighed in with her, I was at 269. She explained all the different types of surgery, what she recommended and why. She put me at ease and made me feel that I was in good hands and there was going to be an end to all of this.
Vera really did great during her postoperative period. To date, she's lost just a little bit over 100 pounds, 102 pounds, but she actually continues to lose even 3 years out from surgery.
And so I didn't know that Vera was going to come back on this one particular day. In she walks, and she's 100 pounds lighter. And the really neat thing about Vera was that her hip was so horrible preoperatively that immediately after surgery, she had far less hip pain than she did going into the operating room.
And by 6 o'clock that day, I was up walking the halls. It was almost like you couldn't believe it. I got out of that bed and I took steps and it didn't hurt. And it was almost like I couldn't remember what it felt like to walk and have it not hurt.
There were no issues or complications. I kept her over one night to make sure that she was safe, and we climbed some stairs the next morning. Her balance was good. We then sent her home and she starts that rehab piece. And then I see her around 2 weeks later. Sort of joyfully as one could strut into the office at only 2 weeks after surgery, there was Vera. And then I typically see her 3 months out. And I mean, she is back. And 12 days after an operation, the majority of that pain is relieved and their function is far better than it was preoperatively. As a patient, you're just so happy to be there. And as a caregiver, you feel very blessed to have participated at some level in their care.
Everybody has something in their life that they love and brings them enjoyment, and with me, it's my dogs. I have 5 greyhounds. Life after pain is awesome. I pretty much can do anything I want to do. I go to classes multiple days a week with my dogs. I'm back to horseback riding, and I can do anything I want to do. I would recommend Princeton Medical Center for both of the surgeries, absolutely, and I would say don't put it off. Don't let it get as bad as it can get. It's all going to be worth it. My life changed that afternoon when all of the pain block wore off, all of the anesthesia wore off, and the pain was gone. Well, I feel like I gained my life back.